Dr. Gerald Hill. Thank you for being with us. We always appreciate your time. Uh, Are you looking forward to a vacation?
Uh, yeah, Ronnie, that would be fantastic. Except my wife and I talk about that. I think a vacation would be walking the trails in West Bloomfield. That we do that regularly. So
Oh my goodness. I don't even want to imagine what you and your team have been through during this entire crazy COVID 19 crisis, just since all the way back to March. And then you kind of catch your breath. You had the summer off, you catch your breath, but then it's still lingering. We're in the middle of this pandemic. Give us an update where West Bloomfield School District stands right now.
well, as you said, it's been a constant whirl of activity since March, and it would have been nice to have the summers off, but our staff was pretty busy, engaged in planning for the fall, and in the fall we're still planning for the fall and what's to come next. I just need to give kudos to our staff, our administrative leaders, our school board, the principals, teachers, and all of the support staff in the West Bloomfield School District. Everybody's doing yeoman's work, and our motto, our shining light, our focus is the health and safety of students and staff in our community and in our school district. And so, juxtaposing that with the educational needs and the mental health and well-being needs, uh, to say the least, we've been extremely busy.
And we know these aren't normal times, and I feel like you and the others on your team are in such a hard spot because some parents want their kids back in the classrooms. Some parents don't want their kids back in the classrooms. And then you have teachers weighing those two options as well. It's like a lose lose situation. How do you try to navigate all of those voices to come up with a plan?
It's almost, Ronnie, like you have the left hand and the right hand, and you're hearing the COVID fatigue, and I need to get my students back in school for a variety of reasons, home situations, the education plan is different to those that really are really hesitant and not anxious. They're anxious about going back at all. And so whenever we make a decision or an announcement, we get feedback from both sides. And so it's been pretty equal. And so um, my focus really is on the health and safety aspect of it and the educational quality aspects. And so we are working with our parent groups, our parents individually, answering questions that they have concerns. It's an impossible task to try to, for a lot of families, to be the breadwinner and the education facilitator in your home. And we understand that. And so, we have the hybrid model, K to 8, but our high school is fully virtual, has been, and for the foreseeable future will be. And so for families that don't have the setup at the homes or have jobs that don't enable them to be with their children full time, it's a challenge, and we recognize that. Um, but it's all for the health and benefit of the students and the staff.
Now, one of the other things we're hearing about, there are so many students, there's a different form of bullying now going on. We talked about bullying so much before this pandemic, and now people are having a direct view into individuals' homes. And so bullying has taken on a different form, per se. The mental health of some of these kids coming out of this, I would imagine, is a concern for you and so many of your staff members and your teachers as well.
It is, and so there are a couple of things we're doing on that front, Ronnie. We do have a school mental health specialist, and we have some restorative practices coaches, and they're working exclusively on the mental health aspect. We're doing a lot of professional development, staff development with our teachers and administrators. The whole camera on, camera off aspect, sometimes it's not appropriate for the camera to be on, and we're coaching our teachers that there are different situations in the homes where that really isn't the best time to have a camera on. So we're looking at other ways we can engage students in the lessons as well. Uh, on the student to student aspect, the bullying, we are a Capturing Kids' Hearts school district, and Capturing Kids' Hearts really emphasizes positive relationships, student to student, staff to student. And all of our teachers, or most of our teachers online, as well as the hybrid in classroom, they've developed social contracts with their classes, what the expectations are of one another. And bullying is an issue, or harassment or teasing even. Maybe it doesn't go to the extent of bullying. And so we're asking everybody to respect one another. And through Capturing Kids' Hearts, it's something that we have been doing for a few years now. So the students identify with that. And so you can see social contracts that have been developed virtually, if you will, for how do we treat each other online.
Dr. Gerald Hill with us. He's the superintendent of the West Bloomfield School District with us today on the Oakland County MegaCast. Dr. Hill, going back to the Return to Learn plan, it's constantly being updated by the school district, by the school board, as it is in many other school districts as well. It's a living document as we continue to move forward through this pandemic. How is what we're experiencing right now, what West Bloomfield's doing right now with Lakers Online and with their in-person and online hybrid at the K through 8 level, how is that impacting how the school district is reimagining schooling in West Bloomfield, both in the immediate future, in the next semester, the next year or 2 years, and into the distant future, as well as technology certainly going to have a continued impact on education for years to come?
Well, Tyler, that's a great question. As you know, when we first got into the virtual learning last March, it was flipping a switch, and it was a very crude implementation of online learning. And our teachers had to overnight learn how to teach online, and that is not an easy task. Over the summer months, like I alluded to earlier, there was a lot of professional development. We've improved our learning management platform. Of course, the teachers are learning that system as they're using it. And we've gained a lot of insight into what works and what doesn't work. Moving forward, we have a committee right now at our high school, West Bloomfield High School, and it's really a return to learn for the high school once our area gets in a phase where it's safe to bring students back. And that committee, they're looking at everything about high school. What can we use when we reopen that is working now? What can we maybe not go back to? And I'm going to say, let's take a look at the start time. Historically, our high school started at 7:03 a.m. Every morning. With the online version, it doesn't start till 8:30, 9 o'clock. The feedback that we get from students is that they love sleeping in. Their biological clocks are geared to not 7 a.m. being in a seat in the classroom, but just maybe waking up. And so we're going to be looking at our start times. Also, teachers are also looking at what they're doing instructionally. Giving a lecture face-to-face is one thing, but you can have a combination of blended learning plan where you are presenting material online and then having more lab and class discussion activities, project activities in the face-to-face mode. And so I would see continuing that in some form or fashion. And then there's a whole issue of assessment, how to assess. One of the things that I'm hoping to come out of this at the state level is that we get away from the high stakes testing and trust the teachers in the school districts in our state to assess students' learning, as opposed to giving MSTEP or some other test. Just what is important for learning, and what can we do to increase student achievement as opposed to filling in bubbles on a piece of paper.
And Doctor, let me ask you, how do you think that it may look going forward? Because one of the things that you are hearing, there are a lot of students that are struggling right now with this remote learning or the hybrid situation. So if they're not thriving under this format, is it really feasible to implement something like that long term?
I think, Ronnie, what we need to look at is, and we're doing some of it now, is giving students and families choices. And I think the more choices that we have for which is, how do I learn, is what's my preferred way of learning as a student, and giving them options. There can be, we'll still, I imagine, have Lakers Online, which would be totally remote, but I would see much more combination and blended options. And I think there needs to be the traditional scheduling, if you will, in classes, but I think we can look at it maybe more like a community college, especially at the high school level, where it's not bell driven. You're taking classes and the people are coming and going, and it's managing the process differently than we do now, but it's giving students and their families more choices.
And I do love the aspect and the thought of maybe some of these programs being put online for later review because for whatever reason, maybe a student missed something. And so being able to go back and re-listen to a lecture could actually be beneficial to them as well, and if they can do it on their own time. We're speaking with Dr. Gerald Hill here on the Oakland County Megacast. He is the superintendent of the West Bloomfield School District. Looking at that right now, of course, the state has been putting out the list every Monday about outbreaks in schools. What is your thoughts on that? Is it beneficial, or is it taking away from what schools are trying to do?
Well, I think it's putting a focus on what's happening with COVID-19 within the school system, pre-K to college, actually. And I don't think that's all bad. I think it's an attempt to be transparent. Fortunately, in West Bloomfield, to date, we haven't been contacted by the health department, and we're not on that list. I imagine we will be at some point because the incidences of COVID-19 are increasing in our state, not decreasing. I think that looking at it as a point of information, and then as I would, as a superintendent, where did it happen? Is it an outbreak? Did the students become in contact with COVID-19 in school, or was it in the community? And make sure that we do the contact tracing, not we, the health department, and make sure that we communicate with families and teachers. I know teachers are anxious, those that are in the hybrid, and they want to certainly have the students there, but they also want to have them there in a safe manner. And so we need to maintain vigilance, and I think it's just a way so that we don't forget what's happening. You know, you mentioned earlier in the show this whole COVID-19 fatigue, and I think it's ironic. When we closed, there were less than a dozen cases in the state when the governor closed the state. Now we're up to close to, well, we're well over 1,000, 1,500, 2,000 cases a day, and people are, they're sick of it. But the cases are as high as they ever were. Back in June, I thought we might be going to phase 5 and be more open. Now it looks like we'd be closer to phase 3. We're still in phase 4, which says that we're improving, but I don't think we're improving as a state. So it's a tenuous situation, and schools are a part of it. We're a part of the community, and if we can communicate what's happening with our community and families, that's better for everybody.
Do you worry that we will move back into phase 3?
I certainly do. What I hear, you know, it's unfortunate from my perspective that public health crisis has become a political battle, and I don't see the politics in it. I look at it from a health and safety perspective, and I do understand the challenges of parenting in this environment when you have to go to work and your students are at home, and childcare and monitoring and facilitating the learning. That is a huge, huge issue. But I'm confident that we'll, as a community and as a state, be able to deal with it. But we need to be working together and really listening to the health departments and the scientists. And my challenge to the politicians is to let's not have this be a political issue. Let's look at it as a public safety issue and pull together on it.
That is such a great sentiment and a great thought, because we are all in this together. And moving forward, what do you think the future looks like for the West Bloomfield School District, sitting here knowing what you know today?
So we're constantly looking at the plan. As you said, our school board approved our return to learn plan. We meet monthly. Earlier this week, they approved the plan as it is. On November 9th, on the short term, we'll be coming to our board with an update, if there are any updates to our plan. One of the interesting challenges is that we have one set of guidelines from the state, phase 1, 2, 3, 4, 5, 6, and various levels of risk. And then we have another set of guidelines from the Oakland County Health Department. And of course, they don't call it phase 1, 2, 3, 4, 5, 6. They call it A, B, C, D, E, F. And so we're trying to do a crosswalk between those two because we're in weekly communication with the health department. And so from low risk to highest risk, we're right now in the medium risk category. And as long as we're in the medium risk category, we can do our hybrid program. I would like to get, I mean, we're in the medium high risk, I'm sorry. I would like to get to the medium risk where we could do more face-to-face, but I think we're closer to a high risk. So it's a matter of monitoring the data, maintaining the communication, listening to the experts, and then for the community, it's having, we need to constantly be communicating with our community. We are having, launching staff surveys this week. We'll be doing community surveys the following week, and we'll be doing webinars and focus groups and a whole host of communications strategies to get feedback from teachers, from students, from parents as to what they feel is working, what's not working, and moving forward, what can we do to improve the services for students. Well, one thing we have to remember is this is a new experience for teachers. Every teacher in the United States feels like a first-year teacher. And I recall many years ago now, my first year of teaching, I was lucky to stay 1 week ahead of the students in terms of my planning and getting organized and all of that. Well, we have 350 teachers in our school district, and it's like they are all first-year teachers because everything is so different. And so we are supporting our teachers as much as possible. Our support staff, paraprofessionals, the same. And I think the more we communicate with each other, teachers, parents, students, the better.
Talking about the teachers as well, some of the teachers have been maybe teaching for quite some time. These kids are smart when it comes to technology. They're smarter than us, they're smarter than their parents, so it's got to be hard to stay on top of them, trying to navigate a new platform, trying to teach, but also battling their knowledge of technology over your own.
Actually, if we had a case of the first early time in school, the Zoom bombing, so we had to change our authentication protocols so that we can track who's on, and we can't share that information because of exactly what you said. The students figured it out real quickly, and idle minds come up with creative ways to be disruptive, and so that's what was happening across the United States. And so, but to the students' credit, they're not afraid of technology. They're willing to do anything. And as a matter of fact, when we do our focus groups and surveys of students, I think we need to tap into that. They've grown up with technology, and they would certainly have ideas on how we can leverage it more effectively. And so bringing them into the conversation would be beneficial to not only the students, but the teachers as well.
Dr. Gerald Hill with us. He's the superintendent of the West Bloomfield School District, joining us on the Oakland County Megacast. Dr. Hill, just another couple of minutes with you before we'll have to say goodbye today. Is there anything else that would be important for our audience to know, for the parents, students, and staff of the West Bloomfield School District to know, or anything else that we haven't discussed today that we should be speaking about?
I think I'll just reemphasize the importance of keeping lines of communication open. If you have a question, ask it. We try to respond to all the questions that we get. Also to understand that the teachers and students are working to the best of their abilities and capacity, and we all can be supportive of their efforts, and we are. And I think that to look at the whole issue as a public health / education challenge, and that we are very capable and creative and determined people, and I know that we'll find this path forward. And looking back maybe a year or two from now, maybe we will come out of this with some better ways of teaching and learning than we had going into it. And we will also have a much greater appreciation for the role of teachers in our society. It's not an easy job. It's a challenge. You're making thousands of decisions every hour, and those decisions are impactful for all the students that you work with. And I think parents, having to have experienced a lot of that at home, have a greater appreciation. But again, I can't say enough for the teachers, not only in the West Bloomfield School District, but throughout Oakland County, because we rolled up our sleeves. We're keeping students first, and we're providing top education for the students that we work with. And there are mistakes we make along the way, and then we learn from those mistakes and we monitor and adjust. But the bottom line is for the students' health and safety.
Dr. Hill with us here on the Oakland County MegaCast. Thank you so much for your time, and I think you definitely said something that resonates with every single parent out there as they appreciate teachers and what they do so much more following this pandemic. So I let's hope that our teachers can get a raise coming out of this, but also that we learn and we grow as well, and that sometimes our system, we need to be pushed to be able to make change, and this is just the push that is being forced upon everyone to make changes, and so hopefully some will be for the better in the long run. Thank you so much, Dr. Hill, for being with us on the Oakland County MegaCast.